The Devon-wide AMP service was formed 4 years ago as a result of difficulty in recruiting and maintaining approved mental health professionals within Devon. The way we used to work is that we used to be based in community teams, and we often worked in isolation, which could be very difficult. Since then, we have made huge improvements in the way AMPs work. It's now a much more cohesive service. We feel much more supported. We're able to link in with a variety of different teams.
That model now means that we have a lot of peer support. We have managers on site, and a lot of the difficult decisions we have to make as AMPs can be shared, and that's a very supportive place to be.
Our hard work has been recognised. Last year we were nominated for a national award, the Social Work Team of the Year award. We won that award, which, as I said, is a national award, so that was a huge achievement for us. This year, alongside some of our other DPT colleagues, we have been nominated for a Positive Impact in Mental Health award. Again, this is a national award, and what's really important to us is that this is service user led.
We as a team were absolutely thrilled that as a part of the organisation we got good in the CQC rating. We got some feedback from one of our carers and relatives that said his words were, it would be criminal if we didn't get good. He was so proud of the fact that his wife managed to recover. And in actual fact, he came in yesterday to see us, and he's made quite a significant donation to the Beach Trust Fund. We were so thrilled, and so were our patients, because they were also actively involved in the whole CQC day. We as a team have worked really, really hard with collaborating with our patients. I think the word they use now is co-producing, because at the end of the day we're all people, and it's so important that we work together. And we have a patient meeting on a Monday morning, and it's a non-agendaed meeting, and it's an open environment where people can talk about what they're concerned about. Then this gets fed back into our staff meeting in the afternoon, and again that's a non-agendaed meeting where the consultant comes along to the cleaner. We're all vital parts of a team, and you know, we all have a responsibility to support each other and to listen and to try and work together to solve any problems or any issues that we have as a team. And I mean the team in the broadest sense. I don't just mean the clinical team, I mean the team as the patients. When CQC did come in, actually they said we were like a family, and in actual fact a lot of the staff actually talk about the Beach family, because we do support each other and we do look out for each other in good times and in bad times.
I've been part of the Beach team for 11 years. I absolutely love my job. It really feels part of a family, working on the Beach unit. Very privileged as well to work alongside a fantastic manager who encourages us to be open and honest. Any concerns we have, we talk about it. There's been times where we've had challenges, like any other ward, but I felt really supportive, and I haven't had to take that home with me. We've found a safe place, we've talked about it, I've got the support, and it's really helped me. And the other staff as well, they know that they're supported, and we'll support the manager just as much as she supports us.
We've got a good solid team in Newton Abbot, and we're sort of trying new things and do new adventures. Part of which we're doing is looking at the initial intervention, which was come out of all the recent CQC visits, about looking at how we can identify better care pathways for people and looking at reducing waiting lists, psychological therapies. As part of that plan, it's about what we can do for the individuals, and it's certainly about making sure we plan a service for them and not trying to make them fit our service. We were asked to pilot the initial intervention programme, which is around, I suppose, brief intervention with people, looking at what we can do to support people in the here and now, trying to reduce waiting lists, trying to get people seen quicker, and trying to find out an accurate care pathway into the direction they were going and what their needs are. Rather than trying to make them fit the service, it's trying to make the service fit their needs. And we've been working really hard as a team. There's been lots of changes, there's been lots of difficult challenges to come over. Ongoing hurdles that there always are around these sort of things as we're trying to get it off the ground. But so far it's been really positive. The staff have taken to it, they've listened, they've learned, we've adapted it to our needs. We've looked at ways it can help us and also ways we can influence it to make it a better sort of service.
We sit within the IATS, the Intensive Assessment and Treatment team, and see adults with learning disabilities and complex physical health needs. We provide intervention such as hydrotherapy, home visits, and we're very proud of some of our newest work in postural management clinics, and also working with colleagues for falls risk assessments, and being part of DPT Getting to Good.
This year we've been particularly proud. We've been working on a new falls screening tool in collaboration with our mental health physiotherapy colleagues. We have met up and reviewed current falls screening tools and developed our own one for DPT. And we completed different tests of changes on the Franklin wards where nurses got to try it, and then we responded to their feedback and adapted the tools to meet the needs for everybody. And it's now gone live on Care Notes, and it's currently used across the inpatient units and mental health, and in the learning disabilities in the community teams have started to use it as well. So that's been a little success story for this year.